why is blood pressure significant? Like, why is that even a thing? Why is it important? Like, we have different vital signs. We have heart rate, we have blood pressure, we have respirations. But like when it comes to like the blood pressure, like, do you understand the purpose of that?
Not
And
really.
and that's one of like that's one none of my students know what the hell this means. You know what I mean? So look, you have a blood vessel, right? And the whole purpose of the blood vessel is to carry blood so that blood can eventually go to like a cell. And this just represents all the cells of the body, right? Whether it's your neurons of your brain, the skin cells, the eyeball cells, whatever. But the blood and the blood in itself has cells as well, right? And what they're supposed to do, that little red blood cell, it's supposed to transport oxygen, the gas oxygen into the cell, and then the waste gas is known as carbon dioxide. That's the whole purpose of blood. Now, blood pressure is the strength that's being created within the blood vessel to send that blood to those areas. So like, you know that we have different blood vessels that go deep inside the tissue so they can get into like the deepest part of the brain or like the liver or whatever, right? So your blood pressure is important because the blood is carrying that oxygen. The blood is carrying oxygen and the pressure has to be high enough so it can shoot the blood into the deep parts of our body. But if the blood pressure is too high, it'll damage those tissues. And if the blood pressure is too low, it won't even make it to those tissues. Do you see where I'm going with that? So
Mhm.
that's the whole purpose of blood pressure. And blood pressure, the average blood pressure is different for everybody. But in the context of NCLEX nursing, 120 over 80 is the average. But these two numbers represent something, okay? You know how when your heart beats, you know, it it beats and then it relaxes. It beats and then it relaxes, right? That lub dub. I want you to know that when the heart contracts, when it beats, that's known as a systolic pressure, the top number right here. What it's doing is it's measuring the pressure in the arteries of your arm because that's the fastest way that we can measure it, right? That blood pressure cuff goes on your arm, it squeezes it. And as the blood, your heart pumps all every second, And so what it's doing, it's measuring the pressure inside those blood vessels. And of course, the top number will always be bigger because that's measuring when the heart is contracting. That's the systolic number. But then you have the relaxation of the heart. And the relaxation is just, if you can imagine, the heart pumps, that's the contraction, that's systolic, and then the relaxation, that's the diastolic, right? And so the relaxation is known as your diastolic pressure, and that's the bottom number. That's why the bottom number, the diastolic will always be smaller. It'll always be less because the pressure is less when the heart is not squeezed.
Right.
You see what I'm saying? That's what this is. So this is something that we just use in medicine to find out, hey, is this patient's heart and blood vessels doing what they're supposed to do to send the blood to the different parts of the body? And you understand that, like if your heart's right here, right? It's easier for your heart to pump blood close to the heart because it's so close. But when it comes to your fingers, your toes, your heart, that's the furthest away from the body. So your heart has to pump strong enough to make sure that it gets blood to all of those locations. That's the purpose of blood pressure. Okay. And so it's like a delicate balance. If it's too high, it'll destroy blood vessels. If it's too low, the blood won't even get to the location. So both hypertension and hypotension will lead to a lack of perfusion, meaning a lack of blood supply to the tissues. Does that make sense?
Mhm.
Okay. So that's the important part about blood pressure. And to get a little bit more precise when it comes to blood pressure, your blood vessels themselves can also independently shrink in size, constrict, or dilate so it can also help move that blood to where it's supposed to go. Like the heartbeat itself is just what gets the blood going. But of course, your blood vessels, they help out because your heart can only go so far when it's pumping. Then your blood vessels can like actually get smaller and squeeze, shoot the blood deeper into the tissues or dilate and decrease the amount of force that's going to the blood vessels or the tissues, excuse me. So another thing I want you to know is that when blood vessels constrict, when they get, and just my little picture of them getting tighter, that's going to increase your blood pressure, meaning the pressure is going to get higher. Imagine you're choking somebody. There's more pressure, and vasoconstriction increases blood pressure. Oops. And as in vasodilation, when the blood vessels open in this fashion, well, that decreases the blood pressure. What I mean by that is imagine there's a little dude inside of that vessel, and there's a dude inside of both of these, right? Which one of these two is the tighter space?
Top one.
The top one. And so if it's tighter, the pressure, it's more pressure. And that's what I mean by higher pressure. And then when the blood vessels constrict, and then the dilation, well, now there's less pressure inside because there's more room, and that drops the blood pressure. Does that kind of make sense?
Mhm.
So all of our medications that we give to lower blood pressure, they do this. They're supposed to dilate the blood vessels. And your body naturally, when it like I think this has happened to you because it happens to everybody. When you're laying flat in bed, right? And you get out of bed so quick, right? What your body is supposed to do, if you're a healthy person, like your heart still should beat the normal, whatever it is, 80 beats per minute, whatever it is for that person. But your blood vessels, when you get up real quick, your blood vessels will naturally now constrict to shoot the blood to increase the pressure so we can get that blood to your brain because now you're moving around. Does that kind of make sense?
Mhm.
And then when you're laying down, your blood vessels don't have to constrict because there's not a lot of it's like everything's just kind of steady. So your blood vessels then relax and your heart does the pressure that the heart creates is enough. All I'm trying to get at is there's a couple of different elements that help us create blood pressure. Blood vessel, the diameter, whether it's the dilation, constriction, and of course, your heartbeat. Um, the average blood pressure, like I mentioned before, is 120 over 80. Okay. Hypertension, according to nursing, is 140 over 90 or more. That's now considered hypertension. That can lead to potential problems because we have so many blood vessels in tight spaces of the body. And if your blood pressure is 140 over 90 or more, it's going to start destroying and like literally the cells start dying. And this is how people develop kidney failure because you have so many cells in the kidneys and years of hypertension, you're killing all the nephrons. And eventually you develop kidney failure. You could develop a heart attack. Even you can develop heart failure because check this out. If this is your heart and it's pumping blood, but the blood vessels, because of smoking, because of bad diet practices, whatever, they're really constricted because of atherosclerosis, all that plaque buildup that we discussed in the past. And then, so you have blood vessels that look like that, and you have blood vessels that are healthy, just regular. This is not necessarily dilated, it's just healthy, right? In order to push blood through both of those vessels, which one does your heart have to work harder to push blood through?
The
The
constriction.
the constricted one. So if you have somebody that's smoking all the time, that's always drinking coffee, because caffeine also constricts blood vessels, by the way, or that has a bad diet, you have atherosclerotic plaque. Eventually, after years and years and years of having hypertension, your heart will eventually begin to fail. And that can lead to heart failure. So you see how all of these different problems that you have when people have, all of that has to do with blood pressure.